Thank you very much. Going back to the first one, just to clarify, Dick, you said 22,000 sites with planning permission and then 4,000 under construction. Is that 4,000 within that 22 sites with planning permission, or it is? Okay, so my first question is, looking at Dublin City Council housing list, has Dublin City Council got the capacity, or what will it take, whether it's in partnership with the private partnership, private developers, to clear that housing list? I know it's a very broad question. And it brings in then the Docklands and the SDZ. And the fact that, the 10%, while there's no buyout, the 10% is extremely low. And I know what you're talking about in your previous answer there. And I know the dangers of ghettoisation. But 10% is extremely low. And is there something, recommendation from here that can go, that should be increased? We know down in the Docklands there's going to be an awful lot of office business type development, and some of the accommodation that will be built will be for those to attract employees in. So I just make a plea for people who need not so much somewhere to rent for work, but people who need somewhere place to live. The second one is on the voids, and I know progress is being made, but there are still unacceptable levels of voids, and I'm talking about Dublin Central there. Two things. One is about the clearing out of perfectly good accommodation. And we know that this is costing an awful lot and it's taking time. So can that be looked at? Now, I know somebody coming in, they want their own whatever, but we do know that there's really, really good accommodation being gutted, which I think is a waste of time and a waste of money. To turn around the voids quicker, have you actually got the manpower and woman power to do that? Especially as the Minister did say on one occasion that money was no object in relation to the voids. On the modular, the cost, when we were down in the site in East Wall, it was extremely reasonable cost, but those costs have been added to considerably, I think, in certain places. And again, what can be done about that? And on the homeless issue, the average time on the list is getting longer. We know that. The 50% that goes to homeless lists, are you going to look at that again? Because it's having, the law of unintended consequences on those who have been waiting really, really long times on the other list. I do know that sometimes people are recommended from the homeless list and they're not acceptable to the particular housing body because of their chaotic lifestyle in very active addiction. And I know that has held up places being offered because it has to go on that homeless list. So can there not be a bit more give and take, or a bit more leeway between the two of them? People will say they don't want to go into hostels because of the risky behaviour. And we've had the conversation before, Cathal, about the drug-free accommodation. But I've been in quite a number of the hostels. I've met the staff and I've checked about the kind of training that they do. So what are the levels of unacceptable behaviour that's going on that people are saying that it's not safe to go into hostels? So that'll do on this round.
Thank you, Deputy. We'd start at the voids. Dublin City Council at the moment has a void rate of 0.79, which is extremely low. I think under a normal operating environment, you'd be looking at somewhere between 3 and 6%. So that's the first thing just to say in relation to that. There has been substantial amounts of money put into voids in the last year or two. So that's the current position. Some of you're talking there about regeneration projects that are taking place in the inner city, and part of the regeneration projects are to require that you detenant parts of the properties in order for them to be ready for demolition to build new units. I think you also know that the communities that we're talking about here, the regeneration communities, have suffered greatly over the last number of years, have had broken promises made in relation to their accommodation and indeed their general environment, etc., etc. What the City Council is doing in relation to regeneration is honouring the promises that we have made to those tenants and those communities. And it would be my view that we should continue to honour our promises to those communities and to effect the regenerations as promised, admittedly several years later than promised. But I think we must honour and keep our word in relation to those communities. Cathal, did you want to?
Yeah. Thanks, Nick. Deputy, in relation to the allocations directive, so just for clarity, so the directive is a ministerial directive which is 50%, not just for homeless, but other vulnerable categories of households for Dublin region only. There are different numbers for other parts where the issue is acute. If you take last year, we have achieved 1,059 tenancies. In other words, 1,059 households moved out of homeless services last year. Record achievement for homeless and housing services over that year. 87% of that 1,059 came from local authorities and approved housing bodies. That says a couple of things. One is that the local authorities are literally pulling out the stops to see can they actually assist with the tumultuous challenge that we're facing on a day-to-day basis in terms of households staying in homeless services. It would be the view and the concern of the local authorities that whilst that directive certainly gave us the uplift that we needed because we were in a crisis, that maybe we're at that tipping point now where perhaps there is a concern that it may be inducing. I have to stress that the households that come to the local authorities for assistance are all low-income households. You're not talking about millionaires coming in the door who can provide for themselves. You're talking about very vulnerable households who need help. So there's a balance to be struck, and we feel that perhaps we're at a tipping point now, given there are such constraints in terms of the availability of property, that perhaps we need to, for a period of time whilst we wait for supply, we may have to be asking people to look, we're not able to respond to you immediately. You have to consider other alternatives whilst we wait for housing supply to kick in. So that concern has been raised. We know that the Housing Agency is carrying out a review of the directive. So all the stakeholders will be asked about what they think about the directive, and it will be really up to government or the minister or the department to decide where they go from there, but that will be the view of the local authorities. In relation to the concern around drug-free beds within the region and the issue of vulnerable persons who have very complex addiction needs, you're quite right, that's always an issue for us. I'd say two things about that. One is, if you take last year in Dublin alone, the local authorities and the homeless services provided accommodation by the end of the year to 5,480 adults. That's not including children. That's phenomenal. 38% of that cohort were never in homeless services before. That's phenomenal. Unheard of in my experience. If you take, for example, on the 31st of December, if you take even just like a census night, 2,279 adults, not including children, were in homeless services. We have increased our emergency capacity by about 70% since 2014. That says two things. One is we are at full occupancy and capacity. That is going to cause constraints around our ability to be able to match the right bed in the right service with the person to meet their needs. We do our best to do that, and I hope you'll appreciate that we try and work on that on a day-to-day basis. We have in the region of upwards of 300 beds that we would see as being drug and alcohol free. The staff that work in homeless services, I think, under extreme conditions, perform a most diligent professional job to the very best of their ability. That includes local authority placement staff who are under extraordinary stress on a day-to-day basis, understandably so because they're dealing with and working with very vulnerable households. Likewise, our colleagues who are in state-funded NGO services are in the same position. The qualification and the standards required to work in the sector, we do have a competency-based framework under our HR framework, where staff do have to have a basic level of accommodation. Most staff are trained in the area. We ourselves set up a unique, I think it's the first of its kind, with Dublin City University and the School of Mental Health Nursing and the Centre for Housing Research. We have a training programme in place for the last 2 or 3 years where the majority of our staff actually have to go through a training programme as key workers to be able to work with difficult circumstances. It is a condition of service level agreements that where you have antisocial behaviour, it is the responsibility of the services to deal with the antisocial behaviour and to have in place good neighbourhood policies so that if it's affecting the neighbourhood, that we do two things. One is either the person is transferred to an alternative facility to try and deal with the immediate issue, or there is some level of sanction involved. But our sanctions can only go so far because fundamentally it usually involves a person who is quite vulnerable because they're in a treatment programme and they may be quite vulnerable or experiencing a level of chaos on a particular day. But that's something that we try to work with and ameliorate on a day-to-day basis.
Thank you. There was just a question there, I think, about the difference in cost between the units. Maybe I should explain that. In 2014, we go back to this famous 2014, when we mentioned the possibility of using modular stroke rapid build housing, there was outcry across the country everybody assumed that what we were talking about were school prefabs that we all remembered as being disastrous places that we spent some, if not all, of our youth in. I suppose in order to dispel some of those things, some of those views, we set up, with the industry in fairness, a demonstration project, which was there, and at the time it was clearly spoken, it was there to contribute to the debate in relation to the use of modular stroke rapid build housing. 6 companies from the industry, which I'm very grateful to, came forward and said, yeah, we'll go and we'll take part in your demonstration. So we set aside a site in which we set up the demonstration project, in which to allow the general public, political people, everyone, to have a look at what might be possible in relation to modular housing or rapid build housing, and to dispel some of the what would you call it, fears, if you like, in relation to the old school prefab view. The government had a look at that, and in fairness to the Minister and indeed the Taoiseach, and I think a lot of other politicians, they came out and they decided we're going to move forward with this. But we're going to move forward with this with a couple of stipulations, additional stipulations. One of those stipulations was that the lifespan had to be 60 years. I think the second stipulation that came out from that advice note, if you like, is that the units must comply with all building standards, all building standards. And the final thing in relation to the requirement, which is starting to slip from my mind at the minute, but the final requirement was that we couldn't use the name modular because there were other building technologies that could be brought to bear on the situation, which might be just as good as a modular build. So with that in mind, the tenders went out and we are where we are.